the roll, please?
Yeah. All right. Neil Butnick.
Here.
Judy Neville, Tom Schulte.
Here.
Amy Carroll, who's getting her glasses. We're doing well. Todd Lavieri.
Here.
Michael Chin is.
I believe Michael's on Zoom.
I'm here.
Yes.
Okay. Chris Labrie.
Here.
Victor Alvarez.
Here.
Maria Weingarten is coming or not?
No, she's
Maybe
out.
not. No.
She's not coming tonight.
All right. Robert Hamill.
Here. Bob's online.
Okay. Colin Down.
Here.
And our first selectman, Kevin Monahan. So we're good. We're seated.
Okay. Okay. Okay, so just to get started, just to walk through our agenda a little bit tonight, we will have a budget review. We've got health, human services, we have general government, we have the library, and then we have a second agenda item. Now, for those of you who are new to the board, and can you hear me okay, Tucker?
Yes.
Do I need to lean into this more? It's important. For those of you who are new to the board and for those of you who have been here for a while, as you know or may not know, we are also, in addition to our capacity as the Board of Finance, we have the administrative role for the new Canaan Water Pollution Control Authority, WPCA. In that role, any project that has to do with the usage, the cost, the repair, the capacity, or the expansion of the town water and sewer infrastructure needs to come to us. So there's been an application for a large multifamily development at 751 Weed Street. And that was raised to the town's attention last week. And on February 8th, Tuesday, just 2 days ago, the application was filed with the town. So it's important to understand a few things. By state statute, the town has 65 days from that date, the 8th, to respond with the possibility of asking for a series of extensions up to another 65 days, if I've got that right. Obviously, P&Z has a very important role in how to handle this application and the projected project. And they'll take this up. But because of our role related to the water and sewer capacity, we also need to work with the town engineering, public works, to determine if there's capacity to allocate to a development of this size and scope. We need to vote on this by the April-May timeframe. So with a little pressure on timing and the work that needs to be done in, say, 65 days, we needed to have a first look at this today. So it's fast moving. It just became formal on Tuesday, and we didn't want to wait. We wanted to get into give this board an opportunity, or the authority, the WPCA authority, the opportunity to see what the presentation is. It is not a Q&A session. It's information only at this point. But again, given timing, I wanted to get it out in the open ASAP so that we have our time to do our job right, and that the town, more importantly, could be publicly aware of the application. So again, what we'll have is our normal Board of Finance meeting. We then adjourn that meeting. We go into a WPCA meeting, separate meeting. Nothing changes. We stay here. No breaks. No sneaking out. And then we'll hear this application. And like I said, P&Z will pick it up. We'll do our due diligence over the next 2 months and working with everybody to determine what the situation and status is. And then we need to make a recommendation to whether we agree that there's capacity or we agree that there isn't capacity. And then we provide that opinion. Okay, so that's the process. I just want to make sure everybody was aware of the new news on Tuesday and how we want to move on it when it's coming to us. So I want to make sure everybody was aware of that, and that's the purpose of why we're moving the meeting and having this agenda item, and why we'll have an adjournment after the presentations. So
Could I ask a point of clarification in terms of our role and our timing on that? So this is just being presented to us right now, and then they move through the process with P&Z. Would we be in the position that we would have to vote on this prior to P&Z?
yeah, I'm not
determining what's
sure.
going on?
The first selectman can answer the question better than I can. My understanding is actually we have to do our work first and determine whether there's capacity or not. And then it goes to the P&Z. P&Z could have all kinds of reasons to look at things. They have a much wider remit and purview right than we do. We have a very narrow question to answer. But my understanding, is that correct? That the timing is we have to answer this first, and P&Z waits for that. I learned that. This is fast moving. Just learned this today.
So we would opine on if there's capacity for a lot right now that is non-compliant and doesn't have the zoning and isn't,
Mhm.
it, really?
Yeah.
Okay,
Yeah, that's the way it goes.
huh,
That's my understanding.
okay.
We have 2 months to answer all those questions, but as of right now, at 7 o'clock on Thursday, that's my understanding is how the process works. It seems a little odd to me, Amy.
Yeah, it
Yeah,
seems
that
like,
we-
it seems
we'd
like we're
spend-
kind of out of our lane a little bit on that.
Well, we're in our lane. It's just, it seems like the timing's asynchronous. Why,
Right.
why answer that question?
Sequentially, it's wrong.
Sequentially, exactly. I agree with you
Yeah.
completely, but this is my understanding as of today. So we will get, certainty
We're
on
not
that.
taking any votes though.
No votes. We're not even, there's not even Q&A at this point. This is just hearing what the application is.
All right.
And then we'll begin a process, and I'll ask the Public Works liaison group and myself to figure out, how we're going to gather the data, do our fact. Do we need to hire someone to help us size this? Can we handle it internally? All of those are questions we have to answer, but we will sort that out quickly. But the point was, if the clock's ticking, let's not wait. Let's get going and get the process rolling while we have some time when we can do it while we're simultaneously building a police department. In March. Yeah. Okay.
I have a question, actually. Is the capacity of the sewer system the only consideration that we can take into account? And do we have an opinion from the town attorney as to what would be permissible to consider or not?
Let me sure if I understand your question. The WPCA's remit is capacity.
Solely, that's the only.
That's
issue.
it. Is that your question?
Yeah. that was it.
That's the answer. Yeah. Yeah. Okay. With that introduction, who's up first? Yeah.
I thought, when are you doing the presentation?
Oh, no, we have to do it at the end. We're going to take care of the Board of Finance regular meeting, and then we finish with do the presentation at the end. We have to adjourn this meeting, go into the new meeting.
Okay.
So, hello, how are you?
Good, how are you?
Good, thank you.
I'm Jen Ileson, I'm Director of Health. I don't know if you have my budget presentation in front of you. So we'll
Do
just,
you want to put it on the screen? Do we have it on the screen?
Josh will put it up. We have.
I guess I don't need this then, right?
so we'll start with the mission statement of the Health Department. Is the mission of the Health Department to control preventable diseases through education, inspections, and monitoring by enforcing the federal, state, and local codes, laws, and regulations for maintaining and promoting public health. Summary of major health department responsibility. The department is the lead agency in the emergency response for the COVID-19 pandemic, which includes contact tracing of positive cases, running registration results processes for COVID-19 PCR test sites, running the COVID-19 vaccination clinics, responsible for carrying out and enforcing all aspects of the Connecticut Public Health Code. We license and inspect all food service establishments, daycare, salons, public pools, septic and refuse trucks, private wells, and septic systems. We review all building permits on properties regarding septic. We provide case management for all New Canaan children found to have elevated blood lead levels. We manage infectious diseases such as COVID-19, tuberculosis, Campylobacter, pertussis, norovirus, Lyme disease, E. coli, etc. We respond to investigate various housing complaints from landlord-tenant disputes about rodent vector concerns and general housing complaints. Some major changes to the health department in 2021. We hired a full-time sanitarian / health program planner that immediately stepped in to assist with contact tracing, worked at several test sites over the course of the pandemic. She's been certified in septic for phase 1 and phase 2. Shannon also passed food inspector written certification. There's a second part of that. That is field standardization through the state. They're a year behind while they're working from home. So we don't know when the field component will be happening, but until she does the field component, you can't do the actual food and service inspection. And the state's going through a change of converting to the Fda Code Adoption. So we're all gonna have to get recertified on that too.
When is
Um,
that?
Mhm.
When is that?
Well, it's been trying to go through for 3 years now, so, things don't move fast in the legislature, unfortunately. We've hired 3 part-time public health nurses who are all RNs via ELC grants, written and received by the health department. They assist with contact tracing, epi outbreaks, and obviously administering vaccinations. We worked with the IT department on creating the external link to all our digital files. So now all our septic land use files are on digital, so the engineers and everybody can just pull things up and not have to come in, which has made it easier for everybody involved and decreased FOI requests. Continue in July of 2021, I should say, the health department went through the CLIA waiver process. We became a certified lab. Dr. Reed is the ordering provider and certified lab director. And that's for us to provide rapid COVID-19 testing in the office, which became vital for November through January. And I had done that because the state had closed all the state test sites in June, and kind of thinking ahead, went through that process. Rapid testing has been vital to helping with our schools to identify, sick kids right away, so we can begin the quarantine and isolation process. And all those tests are reported to the state daily. Those are reportable. It's different than the home test.
Right.
State changes that are coming up. We were enrolled in the Connecticut vaccine program through the state DPH immunization program. That we just completed that process in December. We will now be able to administer all childhood immunizations through CT Wiz with DPH, not just COVID. And all the vaccines are provided free from the state. That's part of getting the kids back up to date with their vaccines, because of the pandemic, a lot of kids have lapsed in their vaccination schedules. Again, ELC grant 2, we were able to hire 2 more nurses. That grant runs through May of 2023, but the state's talking about extending that time period into 2024, not giving us more money, just extending the time frame for it. The updated community health improvement plan is due from the state as part of one of our requirements.
Sorry. I wasn't ready for that. So
No.
they've extended the time frame,
But not more money.
but not more
So
money.
basically, if we don't use all the hours, we can keep it rolling instead of losing the money, is
Okay.
basically why they did it. Because a lot of towns are having a problem trying to hire nurses.
Okay,
I don't have that problem.
right, okay.
I have a lot of New Canaan moms that have helped out that are
Right, okay,
RNs.
Okay.
For how long can you keep extending?
They want to extend it possibly into February of 2024.
Wow.
So again, it can run over multiple
Mhm.
budget years. We already have that with the ELC 1. It runs, through November 2022. So it ran over multiple budget seasons. But in the difference between ELC 1, they gave us that money up front. ELC
Right.
2 is different.
Right.
You're going to be submitting and they're going to essentially give you the reimbursement like our other grants work, the FEP grants work. The Community Health Improvement Plan, we do partnership with Norwalk Hospital through Nuvance. The state pays them a grant to do the Community Health Improvement Plan. That's required every 3 years. So I sit on a committee that we meet. We used to meet every month, but now because of the pandemic, we meet every couple of months. So we're in the beginning phases of that, doing the community health assessment and those types of things. DPH, one of the main things with our new commissioner, she's an infectious disease doctor from Yale. One of her new initiatives, she wants to train local health to do infection control inspections in nursing homes. Right now, we only inspect the kitchen, but they have a shortage at the state. So logically, their thing is, well, let's have local health do that part of it too. So we will be getting trained, both a nurse and a sanitarian. Sanitarian looks for structural issues, water leaks, that kind of thing, holes in a wall. And the nurse will go over their infection control measures. And that's one of the main initiatives in this legislative session that the commissioner is pushing for. The next chart is just the positive cases to show how we spiked rapidly or going down rapidly. On Monday, you'll see it go down again as we put out tonight in the alcohol. where the other waves were much longer duration, where this kind of shot right up and shot right down.
John, how many deaths have there been in town?
I've only had one death in the past year. That was called a COVID death.
Yeah.
But it didn't essentially die from COVID. He happened to die with having,
This doesn't,
COVID at the
so this
second
one
day.
goes back to 21. This was last year.
yeah.
There were some in 20, right?
In 20, yeah, we had a lot. We had around 40 in 20.
Mm. Yep. There's more than you think. More than, well, yeah.
The next slide is just inspection and permit data on all the things that we inspect and license. Salons don't get licensed until June. The septic trucks and garbage trucks don't get inspected until June either. Your next slide after that is PCR testing numbers. We had a partnership with SEMA4 and Waveney, as everybody knows. SEMA4 left the COVID testing business. This is the numbers that we had from August till January. We did a grand total of 1,924, positivity rate of 4.83%. That was done on Tuesdays and Thursdays. And when we got notified SEMA4 was leaving us, Kevin and I reached out to multiple testing partners, and we were able to not skip a beat and begin our new partnership with Progressive Diagnostics. That's now Monday, Wednesday, Friday. We actually increased capacity, and it's just using my health department staff and their lab. So it's really no cost to the town. They don't charge us anything. So that's been a great partnership, and the results come that
Same
night,
day, yeah, that's right, yeah.
which is imperative that the results come fast, because SEMA4 towards the end was taking quite a while.
Is that for the PCR and
That's
the
PCR.
direct-
Rapid-
Only PCR?
Yeah,
Okay.
rapid you do in 15 minutes. We do right at our office every day.
Oh, is that open to the public now?
Mhm.
Oh, is it?
We've
Without
put in
an
the
appointment?
alcohol multiple times of the sign up Genius links, and then they just call or show up anytime during normal business hours. As long as you're a New Canaan resident, the rapid testing is free. The PCR testing gets billed to insurance.
Oh, yeah.
And speaking of rapid testing, that's our next slide. We've done 1,326 of that. The positivity rate, obviously, for rapid testing is higher because they're symptomatic. They're coming for, a reason. PCR, you get a lot of travel, or just certain families like to test every week. It's mostly for travel. Vaccination update. The health department's administered 22,768 doses. That doesn't include our pediatric clinic last night until 7 o'clock at Vine. And today we had another booster clinic at Irwin. It shows the breakdown of first dose, second dose, and then with booster. New Canaan has the highest rates in the state in many of the categories. So thank you, residents, for that. The next phase of boosters, we are going to partner with the high school and with the public schools and do another clinic at the high school next Tuesday. We have a pediatric clinic next Wednesday night and another clinic Thursday at Irwin. So we're not slowing down on the number of clinics that we're doing. For mobile vaccinations, we've done 57 homebound vaccinations to date. We've done at the high school, private schools, local establishments. We spent the summer going from restaurant to restaurant, salons, businesses, vaccinating their staff right in their establishment to make it easy. Because many of them, take the train in. And now we're reaching back out because now they're due for booster doses to, again, make it easy and do the same thing all over again. We also have done vaccinations at Waveney Inn, the care center. We've been at Waveney 3 times this week alone just to do their staff with the boosters because they have an executive order that their staff have to get boosted by a certain date. We've also done the town departments, first responders, and we've even done local construction sites too. The new phase that's coming up rapidly is the 6 months to 4 years old. They're meeting on the 15th, the FDA, AICP, And then once that's approved, then CDC has to approve it, then DPH, they're expecting the week of February 21st for that age group. We already had to submit orders for vaccinations, which I've already done. And I've already even ordered a pediatric bed that we're gonna do. That's gonna be different. It's not gonna be mass vaccination. That's gonna be one-on-one, half-hour appointments. The parents can sit there and talk to the nurse or the doctor and not be rushed out of there, especially since with the little kids, you might have to unclothe them. So that's gonna be a whole different kind of scenario. We don't know what the uptake's gonna be. We'll see, but we will be providing it and have that service for our residents like we have with every other age group.
Jen, how about in the beginning of the pandemic, I was under the impression that your department was kind of overwhelmed, short of staff, working long hours. Was that the case? And did that finally stop happening or?
Well, I'm still working long hours, but Kevin's been helpful and my HR director, Cheryl, about getting me, temporary help when we need it. I pull from other departments. Jill from the fire marshal's office helped us, in December and January when I needed to. Bethany staff has always helped when I needed to. So whenever I've needed help, Kevin's been great about getting me that assistance on a temporary basis to get us through whatever wave we're getting through, because obviously we're all tired, but we'll keep pushing through. But no, the town's been great about giving me the support that I need.
Yeah, no other town's done what we've done for the residents, so.
So, thank you, Kevin.
Well, thank you. I mean, tens of thousands of tests, thousands of vaccinations. You're always available. You always seem to be open and able to get these things. You respond to emails in 10 minutes. I'm blown away by how much you juggle. So
Yeah,
Thank
I'd like
you.
to get my life back at some
I'm
point.
sure you
so
would.
hopefully-
I know.
Hopefully there's, some kind of, end in sight, but no, I care about the residents. I may not live in this town, but I always answer residents as fast as possible. I do sleep from, 10 to 3 a.m. But, and then I leave at 4 a.m. I'm here by 4:45 a.m. and then here to whatever time at night that I need to be for the clinic. So next is just the normal budgets. We only ask for slight increases in, overtime and part-time, nothing really major with that. And the next thing we have is capital requests. Apparently it was removed, so I'm asking for it to be put back in for vehicles for the health department. One for this fiscal year and one for next fiscal year. We only have one vehicle for 3 inspectors. And it's an old Crown Vic that's numerous issues with. So I'm using my personal vehicle all the time. So that's really the only request we're kind of asking for. If you can kindly put that back, that'd be great. And then revenue is the next slide. And the only thing I really increased was the plan review because we were almost 20,000 over last year. So I kind of cut it in the middle to 60,000 for the plan review part. Everything else has been up. So that's been another part of the pandemic. Unfortunately for us, septic and building permits kind of went through the roof at the same time COVID's going through the roof. So we kind of got the double whammy with everything. And it doesn't really appear to be slowing down, unfortunately. Or fortunately for the town, I guess.
So is that a good number? 23, 153? Should it be a click higher?
Well, to be conservative, that's what, based off of last year.
Where are we for this year? What's our run rate, Josh?
1.86
We see what'd you say?
for all the building.
Well, 153 was the approved, right, revenue? For this current fiscal year. What are we gonna do? So double it, 160-ish. Okay, that's a good number then.
And spring's our busiest time for
There you go,
septic
200,
and building
Josh.
permits.
It's always slow.
Yeah, but this question is whether or not this COVID State reimbursement, that's $30,000.
Oh, no, that's not in for this.
Yeah, you haven't carried it into the next year, so your 200,000 in actual 21, that's 30,000 state reimbursement. That's not gonna happen, right?
No, because that was part of the original like CARES Act, that
Yeah, so-
30,000.
So the best you could do is maybe 170.
That's good. At 153, being conservative. Yeah, it's close. I mean, that's, yeah, I got you now. Okay.
And then just the last one is just staffing as like reiterated. I mean, I don't feel the need to put in for permanent positions. I've been getting by what we've been doing and it's been working well. And especially with the grants that we've been getting with the state, with the nurses. That's where I really needed the help with the vaccinating. And EMS has done a great job of volunteering to help with vaccinating too. And Dr. Pierce, our HHS chair, has put in hundreds of hours vaccinating. So that's that in a nutshell.
Any questions for Jen?
Thank you.
Oh, yeah.
Big thank you.
Huge thank you.
I think your outreach going out and into people on sites and
Where people
locations
work.
is
and-
unbelievable.
Yeah, it's
Yeah.
unbelievable.
It's amazing. It's amazing.
Well, thank you. We tried. The more we can get vaccinated, hopefully that
Other
this
towns
can
doing
end.
Get your life.
Oh, don't we
Jen,
wish?
are other towns doing going out to the places
No.
of work? And I don't think.
Most towns have like ended a lot of their vaccine clinics.
Yeah.
And, you know, obviously our residents, we give a different level of service, even with the testing. I mean, the other towns like Norwalk and Stanford have gotten the benefit of free testing with the state and everything else where they didn't care about New
Mhm.
Canaan and what we
Mhm.
have to deal with, so. And now as we're moving into the next phase, it's going to be important to keep vaccinations and testing and especially when it's, you know, not really costing us anything at this point. It's the same staff doing it all.
Is there anything you're needing and missing other than?
My
Right?
car.
You're gonna have your car, your car and personal time. Other than that.
My life
Your life,
back.
your life in your car. I think we got the message on the car. What is the car for the 50,000? What is it? Is it a van? Is it a?
I haven't had time to like really, 'cause obviously I've been a little busy.
Kind of
I
been a
just
little
threw
busy.
a number out there
Car
because you know
shopping.
inflation is through the roof and God knows if
Yeah.
we're even gonna be able to find anything, but
Okay.
I just wanted a placeholder, so.
We don't have any vehicles rotating, right? Or
No,
we
no.
should, right?
Well, the
I think the
2000.
request is for something other.
I want a new car. The car is garbage.
2000, I don't think
Possibility.
2008 Crown Vic was not. what we were looking-
2004.
No, I'm saying the replacement's gonna be the 2008. You better be a police cruiser.
Yeah.
Buy this car.
That, by the way, was in the shop when my car, that I was using my personal car, got in an accident and I had to eat the cost of that.
But seriously, Todd's question is, and particularly the slide where you said the state has some changes coming up for
Mhm.
local departments of health. And there's a lot of things where even if they're giving you training, you got to find someone to go there and sit through it.
Well,
You're going to be doing all the immunizations, not just COVID, and you have a whole new segment of the population that can now get vaccinated, the young kids. So
Is this enough?
Is this enough?
So we-
That's what we're asking. 'Cause
Mhm.
this is the board that would say, we hear you. So
yes, and the state realizes we've all been very vocal. If they go through with this other part, we also need money to
Yeah.
get the staffing for that part.
What
And
would-
we've
what is that?
also-
Well, how much would that be ballpark?
We don't know, because there's also a bigger problem that towns under 50,000 do not get per capita funding. So we've been fighting for that, the equity of health departments. Why should we not get per capita funding? And yet everybody else gets per capita funding when we're doing more than the cities like Bridgeport that get, you know, excessive capital fund.
But if you were to ballpark, if there was either something that didn't come through that you might be worried about that might not be funded, or just to make sure is there an amount of
prob-
money that you would say we should probably have in mind that's?
It
to
would
have as a-
probably be like, probably another nurse, probably, you know, $75,000.
Yeah.
Nothing like,
What would we think about putting a $50,000 or $75,000 contingency for unexpected expenses and just have it as a cushion? And that way, you know, first of all, you know the money's going to be there. You know the money's going to be. If
Yeah,
there's
it's
something you
there.
need, you come here in November and say, I know we didn't budget this, but we'll have it.
trust me, Kevin's
You
used
know
to me
that.
going.
I know.
"Kevin,
He knows. He knows, I know, but I'm just telling you what we should think about it. I don't have a problem having, we had a contingency in there. What do you, thing.
it makes
If
that
the
too
CDC
different.
We're just gonna ask for it
We have
anyway.
a contingency.
Yeah.
In general government, we have
Make sure Jen's comfortable that it's there. That's really the point.
Yeah, well, and simply to acknowledge the fact that we've been pretty successful in moving things around, and you can reach out and, you know, fire in different departments, and, you know, that's all fine. But at some point, their professional lives and responsibilities will get back to something that resembles pre-pandemic, and they'll be busy with their own things, that we may not be able to shuffle things around. So
Right.
Yeah, the problem is like, we don't know, because we've been in pandemic life for 2 years of, we're not going back to normal in the health department world. We're just not. I mean, we've already been told your life is changed, your mission is changed. So, but we just don't really know how it's going to shake out. So, but right now we've been able to do everything, and the town's been very supportive, thankfully. So,
Well, that's the process.
Yeah.
I think that's what we're saying. You have a request, you go to the
Yeah.
selectmen,
Yeah.
then they would come to us. So he would come to us and ask for, okay, that's great.
I have
other
a question. Yeah,
ahead.
just, this is kind of a prickly question, but it says
prickly one.
a prickly one. Yeah. It's so, you said that you're, responsible for enforcing federal, state and local codes. Does mask wearing fall under that? And if so, how did you handle that?
well, the only thing with the mask right now, I mean, I work with Brian on things, but we don't know who's going to actually get the power. It's not going to be local health. But Brian obviously consults with me, like Kevin consults with me when it's his power. So, I mean, no matter what you do on that topic, there's the other side that's not happy with a decision, but you have to weigh the mitigation measures, like the testing that we have available in New Canaan, the vaccination rates. I mean, like I said, we have by far the highest vaccination rates in Connecticut, and it's, you know, a testament to our residents. That's why Brian and I are making sure we do the booster clinic next week to give people another opportunity, both staff and students, to get, you know, their boosters before whatever decision happens on the 28th. But no, we work together.
To clarify further, since March of 2020, we've been operating under emergency powers. The state has emergency orders for the governor. We have local emergency orders. And then last August, when the state gave the CEO of the town emergency authority over masking, that I do with the advice of the health director, and Jen does it when the rules come out, whether it's the superintendent or whether the Board of Education has any role. That's not clear yet, but the health director is always part of the process, as well as the two medical directors.
Any other questions? Okay. Thank you very much. Thank you. Thanks, Jen.
For everything, jeez. It's not a given.
All right, everybody.
Yeah. Amazing.
All right. I'm Bethany Zorro, the Director for Human Services for the town of New Canaan. And I just have a quick slideshow for you tonight, just to get an idea of what these numbers mean in terms of an individual coming in for help, human services. So there's a human aspect to all these numbers. So keep that in mind as we go through a lot of these just cold numbers. All right, so our mission statement, which you can read up there, it's divided into two functions for the town. Josh, let's go to the next one. The helping residents obtain appropriate social services and resources. So you've got an individual aspect, as well as developing programs and activities that address developmental needs across the age span for the development from birth to passing. So given these two items, we further break it down. The individual assistance most often is coming in for state and federal programs to see if they qualify, as well as other programs that we might have or other agencies in the area, the resources that are needed. Community outreach, that goes along as well with the programs and the agency grants and other local area agencies that we partner with, and these are other local nonprofits. All right, next one. Just to give you a quick overview, the population served by Human Services, we have the 20,000. And breaking that down, we have approximately 1,000 clients, which would equal about 460 households. The four of those clients, we provide assistance for, once again, the agencies and programs that we offer and work with, as well as state and federal programs that we can apply and help a family or individual receive assistance that they need. We can break down children, adults, and older adults. In terms of the population, the older population, which is the lowest percentage, but it's the highest amount of help that we are giving. It's actually broken down children and adults, putting them together family-wise. So it's like 50-50. All right, the population, going on next to the agencies, the state and federal program agencies. So people have to qualify for these. They'll come in, for example, a family or an individual, and they are in need of housing, medical help with their rent, learning how to manage the medical system, Medicare, Medicaid, Husky, that's your choices, SHIP. And then energy assistance, which happens during the winter, colder seasons, rebates and food stamps. The Unite Connecticut was done on behalf of the COVID pandemic, and that has been very, very helpful, especially in our low-income affordable housing areas. So I just wanted to break down a little bit in terms of the data to give you some metrics. Here we have the CADAP, that's for AIDS. And if there are less than 5 people living in a town, they will not put that down as a number, but we do have clients at Human Services that qualify for CADAP. The Connecticut Home Care Program for the elderly, you have to financially and physically be assessed to see if you qualify for different levels of home care. CHIP, this is the Children's Health Insurance Program. Once again, you can get an idea of the numbers. The MSP is the Medicare Savings Program, and that is for those 65 and older or disabled. And then we have the Medicaid. SAGA is the state administered general assistance. It is very similar to TFA, which is the bottom line, and that's the temporary family assistance, but that is temporary. So there's different points of qualification. And this is when a client or resident comes into Human Services and we're able to help them and figure out what they should apply to and for their scenario. So we wanted to go into which is a very...
Bethany, what's driving the increase in Medicaid?
Okay.
In the chart, it's tripled here.
Yes, so there's a combination. There's some factors here. The qualification levels have changed. Financially, as you know, the income wise, earned and unearned income. The population is aging and living longer, and so you're definitely getting these larger. It's expanding for different purposes.
Did you expect that to continue? Is that the trend?
Yeah, as more people, as we get more lower income housing coming to New Canaan, as well as people are living longer and we're promoting staying in New Canaan, and if federal and state programs and Human Services, we can bridge gaps. People like to, stay at home, age in place.
Okay, thank you.
Yeah. All right, next one, people served by assistance. This just goes, I'm sorry. Josh, back up a little bit. In terms of the Medicare benefit plans, the medical benefit plans, just to break it down, Husky A is for children and parents or caregivers. Husky B is for the uninsured children that are under age 19. They're in a higher income household, but still within the federal poverty guidelines. So maybe the parents are getting able to qualify for regular insurance on the marketplace, but the children, they can definitely go into a Husky category and get assistance there for the parents. Husky C, that was formerly our Medicaid for the aged, blind, and disabled. It was, now we call it Husky C. And Husky D are those residents between 19 and 64 who don't qualify for Husky A because their children and parents are caregivers. They don't receive Social Security or Medicare, and they're not pregnant. So it's Medicaid for the low income adults that have not reached 65 and are not disabled. And then once you turn 65, if you're in Husky D, then you phase out of these medical benefits and you go into Medicare. All right.
You
Now,
just said you phase out in Husky D by age?
by
or
age,
other-
because then
just age.
yeah,
Okay.
65, then you go into the Medicare programs. So breaking this down in terms of cash, food, medical. This is New Canaan. You can see the trend. Once again, the qualifications change year to year as federal poverty line changes for the area. And these numbers, I mean, people are qualifying. They're reaching these brackets that they can get assistance from the state. And this is the client that comes to us, Human Services. I do want to make it clear that we're not just state, federal program, monetary, food, clothing, shelter assistance, which I'll go into a little later. So keep in mind, this is one aspect of Human Services, and it's helping, it's achieving the mission statement of helping an individual with the programs that are offered in our state. Okay, so program participation. I've taken the metrics from the state in terms of what the programs, how the programs work for our town. And then we have the programs for the human service clients. Now there's a point, the numbers for the clients, they're an approximate number. We don't always get all this information. They might need us for just one item, and they keep their other personal aspects to themselves. If you don't have to do a financial assessment, if you're coming in for other things that you don't need a financial assessment for, we miss some of this data, but we have to respect the privacy of the individual, and we can't go into a complete metric system for them with their statistics. So you can see in terms of what the town total number of town residents in the program that we're showing from state data versus what we're seeing, people walking through the door and calling us. And we only service New Canaan residents. So then we come over to human services programs. So on a whole, yes, we are taking care of those that need help in New Canaan financially, monetarily, and sometimes, food, clothing, shelter. We have a wonderful food pantry program, but also what we're trying to get the pulse on in terms of public, another part of the mission statement, the public aspect of what's needed as a community as a whole. And if we see there's a need, we hear there's a need, the commission works on looking at what the needs are as well. We have found other things that do not have a monetary value on them, but they have an intrinsic value that makes this community what it is today. And that's a very caring community. We have a vulnerable population registry. Definitely it went up to, oh my gosh, during COVID, we had over 200 people that volunteers from the town were shopping for on a weekly, bi-weekly basis. It was incredible, the people that came out and the appreciation for those volunteers. We've taken a nice, strong grasp of the employees that work in the town, and that we have wellness fairs. We're now doing the OSHA training, And we run the flu clinics. We have Stretch Lab coming tomorrow for some mental health relaxation, and they're going to be doing, people have signed up, employees have signed up to receive just a relaxing type stretch. What else do we have? We've started the post-vention and crisis team, PACT. In the event there's a suicide, we want to prevent or decrease the chance of a trigger suicide happening. So we have put that committee in place this past year. And then the community outreach team, which is a compilation of the member-based community, anywhere from faith-based to the garden club to men's club. What else do we have? Exchange Club, Rotary, things like that. In the event that there's some reliable information that we need to get out, we can disseminate information with a liaison from each of these categories. And YMCA, you name it, we've got everybody on the list, and we just added Voices and the Resiliencies program and outreach. So we're always working. And last year we hired, when the finance and selectmen and town council allowed us to hire a full-time senior adult caseworker. We have we're just flourishing at Lapham Center, Schoolhouse Apartments. Marcy, the social worker now, she just had firemen and policemen coming, giving lectures at Lapham. We're working with the library in terms of an outreach there. So there's a need, the mental health, behavioral health aspect of this town, as well as the country. It's a huge, huge public health issue, and we are addressing that as well.
Do you do anything with domestic disputes?
Yes, so let me go on to the next. When there is a domestic dispute, what the protocol is, the police give us the information, whether it's to Marcy if it's just an adult, not just, but if it's an adult senior issue, it goes to Marcy. If it's a youth family issue, which most often it is, the police contact Jackie DeLuey, our caseworker for youth and family. And from there, they do a community outreach at the initial point when it was done, and then they wait a couple of weeks because it's a very much of a crisis time, and things have relaxed. We do follow-ups along the way. Some families, some people want us to stay out of it. Others just are very appreciative of the help, and we get resources.
So that means you're sending somebody to the home and speaking with the people, or what does that
No,
mean?
we do calls and we ask them to come in too.
Yeah.
But there have been times when, they have been asked, the police know that they can call us. Marcy goes out on a weekly basis with Adult Protective Services and the police about concerned seniors that are a danger to themselves or others. And that's when we get Adult Protective Services involved. And there's just so many aspects that we can get into: conservatorship, trying to find family members, helping pets that are not being taken care of properly. Each individual, we don't know who walks in that door, or when the phone call comes in, but we do have to know all the resources, and the resources have to know us too, to call. We definitely have privileges, cell phones for Silver Hill, for Dr. Gerber and his secretary and things like that. And it's amazing. The more you partner, the more you network, the better chance a resident has for navigating, having a result turn into a positive. For so many situations, we just don't know. So this is what I'm getting to the next category, the other agencies. There are agencies that we tend to really utilize during the year, and they ask us for money. And this is one of the part of the budget of our line items for human services. Child Guidance Center, Southern Connecticut. That is counseling, long-term counseling, not just at a crisis moment. What we would do is Kids in Crisis, which we pay for a year's salary for the high school Kids in Crisis counselor to be at the school. This is proven invaluable. Number one, it doesn't go on the child's record. It's totally confidential. And at one time, Kids in Crisis was considered almost a bother in the school. And then when the counselors in the school and the families and the kids realized it's a safe place to give the facts, we're trying to get one now into the middle school. And the Board of Ed has agreed with their ARPA funds to fund for 3 years, middle school.
2 years.
2 years? Are we done? Okay, 2 years, the middle school. We're trying to find a counselor, Kids in Crisis, that would have longevity there. And that's been difficult, but that's going to be a line item. That Kids in Crisis is going to double in a couple of years, because we do want to see a counselor that is transparent, non-judgmental
Right.
for the child and the family.
Is there any state or federal funding for that?
The 2 years.
The 2 years from the Board of
I see.
Ed, but state, federal funding, Kids in Crisis, they raise money, they get grants as well to try to lower our cost, and they also try to get other community resources. But right now with COVID, it really, their types of donations really went down to very little, and so now we are picking up the whole salary.
The New Canaan Community Foundation also gives grants to all these agencies.
And they have another, Kids in Crisis has what is the Den for Grieving, and Community Foundation completely supports that. And that's a whole nother aspect of Kids in Crisis. There are towns in Fairfield County that are trying to get Kids in Crisis. They can't take anymore. So yeah, we definitely are very fortunate. We started Kids in Crisis with Kids in Crisis. We were one of the first.
And it was a well-fought
It was a
battle.
well-fought, yeah.
And the Saks is 10 years
Jenny, you know the
making.
whole-
Oh,
yeah.
God, it was
You
like
know the history.
full-time. Yeah, but it's okay. I mean, look, it's worked out.
It's
I mean,
worked
10
out.
years for Saks, but better late than never.
Exactly.
You think the grant will be continued for any other purpose than COVID for the Board of Ed?
For Kids in Crisis,
Yeah,
helping them. I don't
unlikely.
know.
I don't know.
There's room for partnering.
Yeah.
I'm
All right.
optimistic.
Well, anyway, it's good.
Yeah, but we'll make sure that,
Yeah.
you know, that the middle school gets a
Either way.
chance for this asset as well. DV Crisis Center, that's the Domestic Crisis Center that you were talking about, Victor. We give money to that. And once again, it's a whole protocol, police, human services, DV Crisis Center. Jackie also, the youth family counselor, works with them in terms of putting out this comfort level, trying to erase the stigma. Please come forward as privately as you want. You know, we can make it as private as you want, but we have to publicly put it out there. So there's a fine line. The Get About, which we've taken over, Human Services. I was just at their monthly board meeting on Tuesday, and they are doing great things. But we have asked for ARPA funds through Human Services for the Get About to receive another van. Because the adult daycare program has been nixed at Waveney the past couple of years, we're finding residents that are in isolation and their caregivers are in need of respite, relief from taking care of them. So Elder House, just last week, we partnered with Elder House in Norwalk and the Get About, and the Get About will now have transportation to Elder House 5 days a
Good.
week for those needing respite, the caregivers, as well as isolation aspects for the elderly homebound. So that's fantastic. Meals on Wheels, we all know what that is. New Canaan Cares, unbelievable agency that works with Jackie mostly for youth and family. And it's just amazing, their programs, their speakers. So we definitely support their cause. And Community Program Wellness, we're requesting $10,000 to be used at our discretion for organizations and clubs focusing on mental health, well-being, things like this past fall, we definitely helped the addiction vigil that Paul Reinhardt does each year. And so we definitely see where the need is and where the support is, and we're there to be a part of it. All right, the next slide. So the community outreach and education, this is what the caseworkers, this is whom we work with, and then some in terms of our area, our catchment area. This is working, the organization, there's no reason for us to create all the services that are needed. We don't have the capacity. Our population isn't large enough, cost-effective wise, to have all these different things just through human services. In order to be effective, efficient, and for the community to be able to receive these services, we cannot be a silo. We have to have this partnering and collaboration. And it's unbelievable how everything is, the more it's integrated, the more help that gets out there, and the more people that come to us and come to these other organizations. It doesn't matter if they don't come to us, but if they hear about an organization, domestic violence or kids in crisis, if they hear it through us, they come to them directly, that's fine too. But I just wanted to show you, giving you a fluid based on the mission statement. This is just an ongoing map of what happens between a community, an individual, human services, and what we can create. From every aspect of partnering, outreach, assistance, intervention, it is constantly moving, constantly changing. The public health issues, although, mental health, behavioral health is a huge one here to stay. We also have to keep a pulse on other things that are emerging or might be quietly in the underground, but we need to make note of them too, and know the resources. So in closing, this is our budget. It's not a lot different than last year. What you see is we are definitely, we are the positions that we have now, they're all full-time. We can do what we're doing plus more. And as we increase our outreach and things like that, we're capable of doing it with the staff we have. And it's because the staff is completely dedicated and they love what they're doing. And so when you have that, we had Marcy last night was talking to the police, Stanford Hospital, about a client that was taken for observation for behavioral health issues, was talking to the hospitals 8:30 at night. So we definitely work 24/7, but you got to have your heart in this in order to do it. And definitely everybody's heart is in it at the annex, which is where we're at.
Great. Bethany, can you speak a little bit to the childhood and pediatric psychiatric increases and how we're handling that?
Yes. So now there's the stigma and parents coming forward wanting the help. That is definitely a barrier. So we need to get through that, as well as a child's barrier of coming into the school, having issues. The kids in crisis and the child guidance center are just huge, huge. And then it's also the Board of Ed. It's having a strong system in terms of the counselors, the teachers, knowing, keeping their eye on just the rhythm of the school and who's not looking right, who's not feeling right. So once again, it is the partnering. And then we have the mental health aspect in terms of getting help. There are 77 therapists in New Canaan or servicing New Canaan. So, and they are booked, but we can still find them. There are people that open up more office hours, or they become providers for Husky Medicare. It's definitely a process that continues. It doesn't go away. We don't feel like, oh, this is ever going to be over. Mental health has come to the forefront. COVID has, brought it to a head, and it is about services being offered and knowing those services. The United Way is incredible with helping. Their 211 is just an overview for Connecticut. You can call them for anything. And then when someone from New Canaan calls 211, it goes straight to us. But there's so many aspects of the children and their mental well-being. Pediatricians are on the lookout for it, school nurses. And so it takes a community. It takes a community, but then it takes having the resources And then you can have all the resources and you can have all the education and all the openness, but then it takes that person, that parent, that child to be ready to take on that journey. It's just not a quick fix. You know, it's not
What
that.
about, do you do anything to try to deconstruct some of the stigma of having somebody come
We
out?
do, and that's why we partner with the Kids in Crisis, with the library. Jackie has about $25,000 state grant that she works with. It's only for the use for the well-being of a child. So even prom night to be safe and everything, you know, we help fund the prom night. The moms come to us. And the things that we do, Live Girl, the Ram Council, they come to us to buy the t-shirts for a fundraiser they're having, things like that. So we are getting out there. And then the library has their lectures. New Canaan Cares has unbelievable lectures. So we definitely filter that into our youth and family. We get an email out every month of all the things that are going on. All the things that are
It's
going
great,
on.
by the way.
And
It's
then-
really great.
Yes.
They're doing a good job. Very
Doing a good job.
Yeah.
So it's just endless, but I could go on and on, but just know that everybody's heart is in the right place, and getting people to come forth is the hardest part, but we're getting there.
So a quick question.
Yes, Chris.
Your original Kids in Crisis request was 90,000.
And then,
Why was it 90,000?
so that's what last year, that's what they requested. So I assume they were giving 90,000, asking for 90,000, but then when we got their grant request, it was 85.
Oh, good, okay.
So they went down.
Yeah.
Not us.
That's
Yeah.
a self-inflicted wound.
Self-inflicted wound. So you ask for 85, you get 85. You know,
That's good. All right.
that's the
thank
only
you.
reason.
Any other questions? Do you have anything else you want to cover?
No, that's it.
That's
That's it. Thank
fantastic.
you for your time.
Yeah, no, that was great.
I would mention one other thing.
yeah.
The Health and Human Services Commission at their meeting when they reviewed the budget was talking about the agencies and whether or not we, we tend to go back to the same agencies and not see whether there's other agencies that we should be bringing in. And also they have a concept that this is the pool and we got to reallocate it if we're going to, as opposed to ever increasing it. So we've been flat for a while, but that's one area where we ought to look next year into making sure that if we need more money, we got to be asking for more
Or
money.
either a new,
We'll get
another.
that coalition
Looks
going
like
again and
we
see
will
where
in
those
2
other
years. Looks like we
valuable
will.
assets are.
Yeah.
Excellent. Okay,
Yeah.
thank you.
All right,
Thanks,
thank
Bethany.
you.
Appreciate it.
Thank you.
Great job.
Thanks, Doc.
Josh, are you up? General government?
Tucker, who do we have on remotely for, who's on remotely for staff?
We have Kathleen Tiger, Brian, Lynn,
Cheryl's not on tonight. Okay.
Bear with me 1 second.
Tucker, do you want to come down and join the discussion, the initial discussion for economic development?
All right. So.
Don't have a fancy PowerPoint, but there are lots of spreadsheets involved. So we'll just start with the expense side, and the first selectmen's department is up first. It is a 5.6% increase over FY22, which is a $32,000 increase. The highlights for the first selectmen's department is.
Do you want to show your screen or? what do you
Oh,
want?
sure, sorry.
We can look
What do you
at
want
it.
to tell us what page you're on?
Cover page is
Yeah.
nice, but it's, you know, at some point.
Kind of small, kind of small too.
Small from here.
Are you talking from this?
Yeah, yes.
So what page?
Page three.
Should be page 3 in the,
All right.
yeah, first selectman, right?
Correct.
That's small. Thanks, Chris.
Oh, is that?
Thank you.
Yes, I do. I thought I had one. Just a second. Where is it?
You might make an initial comment about 401A having taken over the pension for new employees and why all the budgets tend to get increased because pension is not in the individual budgets, but 401A is.
So you'll notice that with actually a few departments because there was staff changeovers. So when the staff changeover and they were on the defined benefit plan, which is the pension plan, and then we had a new employee coming in who's going to be on the defined contribution, the 401A plan. So you'll see that difference coming in. You'll see the 401A increasing in those departments for the changeover in the staff from a pension to a defined contribution. And we actually had a decrease on one of them was because the staff member that left was actually on a 401A plan.
Okay.
But it was a transfer from another department and that was a pension, that was a defined benefit person. So it was weird to see the reverse happen in that particular because it was but most of the departments that changes because of that staffing change.
So the two highlights of the first selectmen's departments are, as mentioned, the 401A contribution is up 73%, which is, like Ann said, bringing on someone with the defined contribution. Yep. And also the economic development, which is up 20,000 from last year's budgeted 30,000. And Tucker can speak to that.
Yeah, so hopefully you've been following some of the progress of TDAC. We're just finished our first round of our term of, just let people in, there we go. So what we've decided to do going forward is just focus, while we had spent a lot of time in our initial year figuring out where we were going with it, what our priorities were going to be. What we've done this year is we've really decided that we were going to focus on 3 things. And hopefully you're all familiar with the October for Design event that took place through the New Canaan Museum and Historical Society, brought people in from Palm Springs. It was a huge event to celebrate the mid-century moderns that we have in town, but it incorporated all the downtown business district to be part of it. Another thing that we really would like to work on this year, hence the increase in the budget, is we'd love to really produce some both digital and print marketing materials for the town to really promote the town. So that's something that we've heard over and over and over again when we bring folks in to talk to us, that we really don't have that and nobody really owns something that's really encompassing of the whole town. And then we are working on another major priority that we're working on is a business guide. The prospective business is thinking of moving to town. They would have in one document, online as well as print, would just take them through the whole process of once you've signed a lease, here's how you get your sign permit, here's how you apply for any building permits that you need, here's the people that you call, because we've brought in a lot of new businesses and asked them after the fact, what was the process like? And we heard that that was a real gap. So we're developing those 3 things right now, and that's what our group is working towards. But we get so many requests to support so many different initiatives, and therefore we felt that we had the bandwidth to work on those 3 things, which hence ask us for a few more dollars to support some of the marketing efforts.
And Tucker, I'm sorry, I was looking around for where this was, what you were talking about. I'm sorry.
I saw you.
So the budget increase, it's for the TDAC is
Well,
where.
it's not TDAC's budget. It is the first selectman's budget. We make recommendations to the first selectman.
And we don't really have hard plans as to where the additional money would go, but we feel we need to have more economic development. Support of Maine and Elm in particular. We need to figure that out.
You described was great. I mean,
Yeah, those
it's
are
not
the
a
3
ton.
things that we're working on currently, right off the bat.
It's the 50,000.
Yeah, no, I see.
Yeah.
Helpful.
Very, yep.
So,
And just for this year, like of your budget of 30,
What did we?
how much have you guys, I mean, I know we have months left
Spent it
in the
all.
year.
Yeah. Oh, yeah. We spent it all.
That's fine. Okay.
Yeah, and we could have spent more on some very worthwhile initiatives, but we just didn't have the funds to do that.
Okay. So if TDAC needs anything, it has to come out of this line, right?
So we make a
That's the
recommendation.
only line okay,
As
all
of now,
right.
yeah.
And then in terms of that being distributed, it's at the discretion of the first selectman?
If it's under $10,000, it's me. If it's over $10,000, it goes to the Board of Selectmen.
Okay.
Mhm. Yeah.
Okay.
Thank you.
Keep rolling.
Any other questions on the first selectmen's budget? So moving down to the finance department. It is a 3% increase year over year, or budget to budget year over year. The highlights being increases in salary, which is brought on by 3 new members of the finance team, or myself becoming the budget manager and signing on as the CFO, and Diane joining as the controller. And also, as mentioned, the 401A is impacted in the negative in this case, and overtime is up, which is mainly due to just year end and also fiscal year end and also calendar year end duties that.
And then we're also, there's some projects going on at the moment and efficiencies that we want to run in. So we're doing, as you probably know, converting to a new banking system. So that's taking quite a lot of time to do that while everybody's been supporting the budget, the audit, and doing conversion. So that's going to be ongoing for a couple of months. And then we had year end for us is W-2s for the January timeframe and then 1099s. So there's a lot of overtime that's due at that point because of the pressure to get all those filings done. We're trying to true it up to where it actually should be.
And we might note that it was hard to replace Linda, but we found a CFO that hit the ground running, and it's
Goodness.
Yes, she
You
had
put the
no
T-shirt on
choice.
and it's unbelievable. I mean, you're on the team. Holy cow.
I got a good support team. Now I have to.
No. That helps.
Any questions on finance? On to the next page is the tax assessor, which is actually down 1.7% since last year. As there's been a decrease in full-time salaries due to staffing changes. There's been a couple staffing changes, as well as, again, the 401A contribution because of those staffing changes, and an increase in service contracts because of an increase in their annual CAMA maintenance.
CAMA is their software that they use to do their assessment value. And I'm not sure if it was this committee or it was the liaison that asked about a change of the website.
We did.
Yeah. They changed the website changed, the look of it changed because the assessor moved from Vision, which is one of the major players in Connecticut for a CAMA system, to Equality, which is just as equally a player in Connecticut. So that's why the site changed. They moved to a different vendor.
And if there are no questions, moving on to
I think assessor is one of the few that have a capital.
They do. I'll
You're gonna
cover
do
capital at the end.
Okay.
There's only a few. Moving on to the tax collector, it's a 1% increase over last year, which is the highlight being the 401A contribution again because of staffing changes. Not much else going on there. On the next page is the legal department, which is down 50,000 from last year. I believe it's due to the CBAs from last year no longer taking place.
That jumps up and down when we have negotiations, right?
Yeah.
Oh, yeah.
Well, it's nice to see it jump down.
Just wait.
I know.
Yeah, it always.
Lawyers need inflation too? Wait, what?
No,
The question
no,
is there?
it's actually, it's largely dependent upon P and Z's schedule and whether they're getting sued on appeals and stuff. So, and that is kind of, we had a period where we had a lot of expense. That's kind of waning, but you really can't predict what's going to be. We may actually be entering into another phase.
Down to the HR department. It's a 0.5% increase over last year. The biggest highlight being the decrease in part-time to Diane
That was
moving
Diane transfer.
into the finance department. And physicals being an increase due to new hires and staffing changes, but overall relatively flat.
So the staffing's the same number, but we have different people at different pay grades. I mean, so,
Well, Diane moved to controller.
right.
Right.
And we actually outsourced the part of Diane's job to the hooker and Holcomb, who's doing has an online system to do what she did. So.
Which
Yeah, so you
is
technically went down
great
a
that it
part-time
worked out,
position,
yeah.
Yeah.
And then went to a replacement of a full-time finance.
Okay.
Over to the IT department, it's a 0.5% increase over last year. It's nothing really standing out, just salaries, contractual. And on to the next page is the town clerk.
Hey, can I ask about IT?
Sure.
So, you know, they're in charge of keeping our systems secure. So they're okay with, this is enough money for them, I guess. And, you know, just, I mean,
I think it would
Yeah.
probably be tied into the salaries. They're the first line of
Right.
defense, and their expertise is really what
Yeah.
pushes us in the right
okay.
way.
And they-
Well, are you asking a different question? We invest in software, we invest in lots of
Right.
stuff.
Yeah.
I think that's a great question. Where's that
Yeah,
expense?
where's that expense? Or
Where's
is
the
it
new-
is it in
wouldn't
capital
be-
or something? Or
It might not be in.
I just want to make sure.
Probably service
Contracts, and even I saw it with getting myself set up with the level of security they have, that
Yeah.
I was actually
Yeah, I
really
know.
impressed with it.
Oh, yeah.
Um,
Oh, yeah.
It is
She
very.
still can't get on.
Yeah, that's good. It's working. It's
Human
working.
error, I know.
It's working.
But you know, their level of security and how they have it in the dual, I never say the word right.
Authentication.
The
Authentication.
Irish accent can't do that one.
Dual
sorry.
factor. Dual factor.
So,
Oh, yeah.
We don't wanna talk about
Big
it.
star.
I just want to make sure.
yeah,
They-
Chris would
they have what they
definitely
need.
would speak up if he needed any additional on it, but his guys are very well on top of everything that they
Okay.
go through, what I've seen.
It would be nice.
And they work 24/7. It's
Oh,
amazing.
yeah.
No, I know.
Yeah. From just about anywhere.
No.
And they were reclassified too, so this is current.
They're
This
they're
is-
available
Yeah.
24/7.
So on to the next page is the town clerk, which is down 4.6% from last year.
Hallelujah.
And the decrease, the decrease is mainly due to the outside service contract, which is reflecting of the software.
So during the pandemic, they contracted with COT is their software system for the town clerk, and COT was going through the state with all the towns doing scanning so that you wouldn't have people coming into the building, they'd scan it for you, and then the redaction of that information. So that was put into the budget last year. It's not in it this year, so now it's just their standard annual maintenance fee for their COT system. So that was a big.
So is she current on everything that she has? I mean, are
From my
we,
understanding, the scanning didn't go fully through.
it
Didn't
did.
complete.
Yeah, okay,
So the money
good.
wasn't fully.
All right, that's great.
The only other increase in the town clerk's department is for part-time elections, mainly due to the increases in voting districts, which is
It went from 3 to 7 districts the town has gone, so that's gonna need additional staff, and especially with the mail-in ballots and things like that, it's gonna increase their, and being a midterm election as well.
We'll now have 3 voting locations, not 2. We're at East School. One district has 40 houses.
Is that required? Is that the only way? It's, I mean,
They cut us up badly.
I know they did, but is this our only alternative is to have 3 places to vote? I mean, there wasn't
Well,
any
just-
other more economical.
No,
Okay, well, it is what it is.
down to the registrar of voters, also kind of reflects that change. It's a 34.9% increase from last year, due to, I guess it's part-time salaries for the 2 registrars, as well as part-time election staff to man those extra polling stations.
Corresponding equipment.
Right, and
Yeah, that you're
corresponding
gonna-
equipment.
And all the setup for the new districts.
The election equipment and repairs.
we increased the salaries for the 2 registrars. Effective next January.
And moving forward,
Are they having any difficulty finding volunteers to help them with the elections?
They mentioned it in their meeting. What they do like to have is 2 deputies in each location, but it sounds like they have that already. But they haven't mentioned that they were struggling to get the volunteers.
down to the health and security benefits. That right now is a 5% increase over last year, but those are going to be gone into much more detail during the ISF and Internal Service Fund parts coming, I think, next week, Thursday. Pension and OPEB with that as well.
Well, pension and OPEB work, we do the ADAC. So when we had been doing them every 2 years. So the last time it was done, I believe, was July 2020. So at that point, they set the ADAC, or it's called the actuarially determined employer contribution. They set it then. So we follow what the actuarials tell us.
But we're going to pay $20,000 more to do it every year rather than every 2 years.
We're going to, just because of the way the evaluation of the fund, if it goes up, we want to be able to get that benefit. I mean, it could be conversely the reverse as well, but it would be better to do it every year.
And there's a meeting of the,
Next,
what's the name of that?
It's Tuesday.
Tuesday, to address a couple of issues that require decisions on this as to how to.
Clerk.
And I think you need a replacement for George Blovout on that committee.
Yeah.
Yeah, that's right. I left that on there. Yeah.
Mhm.
Did you skip over land use?
That's not,
Tiger, right? Tiger's coming up for that one.
yeah, that's not tonight.
That's not on.
So this little piece is out.
That's not general government. It's
Yeah, this is just getting more general.
Okay,
government.
it's on your list here.
Well, but it's just, that's just the budget, but it's not the calendar for
Oh,
how we're doing.
all right.
Down to insurance liability is down 1.8% from last year.
There's a couple of different reasons for that, for the offset. Workers' compensation speaks for itself because we've got the claim history out there and how that would work. The insurance blanket coverage last year it was 608. I'm not sure for the reason at that point. I knew umbrella insurance last year for most municipalities was really high because of the cyber attacks that was happening, and it was happening mostly to municipalities versus private industry. So umbrella went up, but we never paid the amount of this 600,000. So we didn't get to the level that we're current budgeting. And this year we're going to come in at close to probably like 520 for this year. So it needed to come down because we're not seeing the same rates as what.
Have we challenged the insurance claims and this, or I should say their assumptions? It's nice of them to say all towns are equal and they're all vulnerable. That we don't have a hospital. You know, there are things about this town that are not as severe and as at the same level of risk. And have we challenged?
I think they take
Their
that,
assumptions.
I think they take that into
I
account.
think they like to think that they take it into account.
Yeah.
I know a little bit
I haven't
about
talked
this.
to them
I
yet.
think we need to have a conversation about that, that we need to really push back on that. We aren't at the same level of risk, and we've invested in tools and technology and things that should make us at least a little bit more favorable. And I'm sure, I'm almost guarantee we'll get no credit for it without pushing for it.
That does what
Probably, yeah.
it sounds like, to be honest with you. It's because when they talk about it being a.
Oh, cyber's horrible, we're all gonna
nationwide
die. Well, I'm sorry,
Robert.
we don't have a hospital. We don't have certain things that are extremely vulnerable and expensive when they go down.
Yeah.
So we need to push on this a little one. This was one where I think we can maybe save a little bit of money.
Also, is Kerma backing out of the cyber coverage and we have to get it elsewhere?
Oh, I haven't heard that one yet.
Yeah.
I could call them and find out. I haven't seen anything on that.
I did.
Oh, it did, okay.
Jeez.
Because it went up, I know, not personally, but, from getting cybersecurity before, it was triple because of the municipality. And there wasn't anything we could do, and we had to put certain criteria in place, and then we wouldn't even get that price if that wasn't in place at that point.
Yeah.
So maybe, okay, they are. Have to find out.
Huh.
She hit the ground running, but she doesn't have everything yet.
That's good though. This is worth looking into.
Well,
a
that,
little bit.
yeah, that's a real, and it's such a huge vulnerability too.
Well, No, no
But
comment.
not.
No
from-
comment.
not
No
from-
comment.
but We've done everything.
Does that cover it? General?
So down to parking.
Parking.
Oh, parking. Yeah. Sorry.
No,
6.
parking's up 0.6. No real highlights, just salaries.
Why not?
We're actually keeping the staff down because we're not really patrolling commuter lots and stuff. So when the parking comes back, we probably will add staff back.
And revenue.
The other would be debt service, which is what it is, up 2.7%. On transfers, which is just the tax support to capital, which is currently 0.2 million. That pretty much covers the expense side. And then onto the revenue side, starting at the finance department.
Which page you on for
page?
revenue?
Revenue is page
18?
8.
Would that be in-
Andrew Brooks owes us money. Is he sitting here?
What's that?
Andrew Brooks. Is it? We gave him a target with our new banking agreement, Ian.
But the reality is the banks pay you nothing. so-
750,000. We said we need income. We're sitting on at any one time, $75 million. I'm sorry. I know interest rates are low, but at $75 million, we should be getting a little bit of it.
But most of that goes into trust funds, not. No, I'm sorry. As far as the
No, no, no.
general fund.
No, 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 no.
Right,
I mean,
okay.
people pay their taxes in
Right,
July and.
Right, right.
That's right.
Andrew Brooks, where is he? He owes us.
So that's at 500,000.
Is it 500? Where's it 500?
Where is that?
First line under
The first line
finance.
on the
Is it?
finance.
Okay.
Yeah,
Oh,
but-
just interest. Okay.
I'm here virtually. I'm happy to speak.
Andrew, down from the prior year, wrong direction. Wrong. We went and did all that great work on banking and you did such a nice job, you and Bob Hamill.
Right. So if you might remember, Todd, from our email exchanges a couple months ago, we are realigning the percentage or the expected revenue for the next budget to be in line with these much lower post-COVID interest rates. We are excited to see to some degree that they will be ticking up, but unfortunately, we used to be collecting 2% interest on a lot of our bank balances, and now it's down to 0.2%, right? So it's a dramatic decrease. But I am excited to work with our new CFO. We just had a great meeting yesterday, and we're looking into ways to invest this money in securities that aren't fully tying it up so that we have the money available to meet our expenses, right? We can't go out 6 years with $75 million where we'll have no money to pay our salaries and all of our expenses. So we have to stagger it in a way that can, take advantage of some of those types of opportunities, but we also have to keep cash in the bank, to facilitate our operations.
And were you the treasurer as well as CFO at Wilton?
Is that gonna get me into trouble?
We'd like to hear the other side of the story.
Hey, Todd, it's Bob Hamill. Andrew and I did look at a number of options, including like short-term treasury and inflation protected securities. The problem is, even though they're liquid, they do have mark-to-market changes. And, it was basically determined that, we just don't have the appetite for any, even if there effectively isn't risk because it's US government securities, any mark-to-market change would, gather a headline, and it's just not, the banks don't want the money is the simple answer. The system is flooded with liquidity. The Fed is still printing money today, up another 10 billion in balance sheet. It is going to stop in March, but it's going to be a long time until the banks are really going to pay you for your deposits, which is why we've got inflation. Anyway, that's my 2 cents.
I do think when we did the banking analysis, we thought we would do a little bit better than what we had with the previous providers, right? So I guess I'm a little surprised. We all know the interest rate story, although the 10-year is at 2% today, and it was at 2% in August of 2019, which was pre-COVID. So I don't know if I buy the COVID story. But seriously,
We could go out 10 years, but to Andrew's point, then you couldn't pay people for 10 years.
no, I know. So, okay, you're telling me we're 500. Don't get excited about 750.
There is a chance we'll have some upside. It depends on where the rates land later this year. So I will keep you informed on any positive developments in that regard.
All right.
I mean, the 2-year did hit 165 today, 1.65%. So if we wanted to ladder some of the money out, it's really a liquidity issue though. So
Yes.
to your point, the curve is moving quickly, but I just, the overnight and very liquid bank market is still far from
Safety first, right?
desiring your money.
We agreed safety first was our principle, and second, obviously, we know that we need to have liquidity, but it's a little
It's really more headline risk because, you lost money. Well, we didn't lose money. We just have to wait until it, pays out. But I don't think there's appetite for that. Anyway, that's enough said.
All right, well, thank you.
So there were two changes for grants that we'll receive, which is the educational cost sharing grant is down about 2,000 from the listed 409. We just got the numbers in today, that it's 407,264. And the municipal revenue sharing grants, I think Ann can speak to that.
I get the bad news.
She gets the bad
We're
news.
probably not going to get that grant. It wasn't on CCM's list and it's not on the governor's list of grants to us. So that one is not coming to us right now.
That's 136.
Due to just income or on any other?
No, this one has, it's a couple of different components of this, and it's to do also with the sharing of the mill rate between the equalization between the towns.
Yeah.
We got a notice about a month ago saying that it wasn't in our budget, I believe, for last year, but the towns got a notice saying that even though it was in last year's budget for the governor, they may not give it to the towns either for this current year. So they're struggling with something with that formula that they do. I don't know the full background, but they're struggling with something. So for this year, they're calling it anticipated that they think they're going to pay it, even though they had put it in their budget, but it's not even in the budget at all for 23.
Okay, interesting. Yeah, something strange.
And the educational cost sharing grant you said came in, how much was that?
407.
407, yeah.
47?
407.
407,
Yeah, it just came
as
out.
opposed to the 31,000.
409.
No.
It's the second.
You look at the
down.
wrong column, next
Oh,
column.
the other
over.
column,
407 versus 409.
Yeah, okay.
Yeah.
It's right below the 500 for interest on investments.
Yeah, this is,
So does
this
this,
is all going the wrong direction.
does this municipal revenue sharing that should come out?
Yes.
Even though, because it's just the information just came over,
Right,
so we're
right.
gonna net that out. Right. Okay, thank you.
And just more, so the education.
Conservatively, it should be conservative.
Yes, yeah,
Yeah.
because right now they're saying they're not
unclear.
going to give it to us.
Got it.
So, but what sometimes can happen on your education cost sharing, there's two they're called ECS grants. One is education cost sharing and one is excess cost. So what happened, the excess cost is typically around 900,000, it has been. At the end of the year, when they do the final payout, they do a final true up again. If there's a differential where you're owed money, that money comes in the next fiscal year as an educational cost grant. So although they're saying we're getting 407, we could get more.
The
If
next
there's then we could get more from this year's excess cost in next year. So you could pick up another 100,000 in that, but you shouldn't budget because you don't know which way it's going to go. But
Well, it's not gonna come this year, so it's.
no, it'll go into 23.
Yeah,
But that's how they work the the excess cost grant.
Thanks.
Any other questions on finance revenue? So down to the tax assessor's office. There's the state property rebate that was missed in FY22. I believe
It wasn't paid out. It's usually paid in October. So we didn't get the payout on that one for 101, although it wasn't in our budget. It is in the governor's budget for this year. That is listed in payout, but right now, can he pull it back the way things are going? I don't know, but it is definitely in the CCM that we got, that it's in the governor's budget. So it's in for this year.
tax collector. Tax collections are obviously just a factor of the expenses. So right now it's at 5.3% increase over last year, but obviously that changes as this process goes on. That's pretty much it for the revenue side. And, oh, sorry about that. Next page is the town clerk's office, definitely not for the revenue side. So the town clerk's office is up 73% over last year, namely due to conveyance fees.
Budget to budget.
Budget to budget,
Yeah.
yep. Conveyance fees being at 2 million versus the 1.1 million from this year. We've seen the trends a year to date. It's over 1.3 million. As well as an increase in recording fees. Everything else is pretty much flat.
So is it aggressive to have the revenue projection so high for conveyance fee for next year? I mean, I know it's very strong this year, right?
So it was 2.8 FY21.
Okay.
And right now this is as of the end of December, I think it's 1.4 something as of the end of January.
Okay.
5 more months to go.
So 200,000 a month.
Yeah.
Yeah,
Ish.
ish.
So you got a
What's the
million,
actual
you got a
tax rate?
million to
Is-
go.
What percentage on the?
Well, there's less houses,
On
not
the-
that they're
the
selling.
sales,
for us,
right,
it's just
homes.
less
So it's
houses.
2 million too conservative.
Just-
Well,
what's the actual
I'm with Amy on
percentage
that. You have to ask. I mean, I think I heard real estate tell, there's 38 houses for sale or something like 56. How many are so for sale?
low.
Well, yeah, but it's February, so you
Yeah.
gotta wait and see what
Yeah, but
happens.
the-
in
Maybe
April,
towards the end of the May, June.
right?
but just what is the
Sorry.
rate, the conveyance rate that you pay when you?
Oh, I
percentage.
don't have that offhand now.
Okay.
Half goes
But
to
the
state.
part that we keep, the part that we keep
What percent?
is quarter of a percent,
Sorry, it's
quarter of a percent. I think
quarter.
we share with the state. They take the biggest piece of it. I think we get a quarter percent.
We get a quarter of percent of.
I think the fee is at 1 and the state gets 3/4 and we get 1. 1/4.
That's what I was curious.
I actually think that's a follow-up item by March. We'll be a little bit more knowledgeable, and is 2 million a click too high or a click too low?
Right.
Chris could be right. It's just, and it could be that it's just to choose 2 million. I'd rather have a number that we beat. We know we can beat it, but
It's a crystal ball.
So it's
crystal
25
ball.
basis points on selling a house.
did you get any input from the real estate brokers at all, or market, or any ideas? No.
Pre-pandemic is only 1.1, 1.2 or 1.1.
Yeah, but boy, nothing was moving beforehand.
Yeah, but
Yeah,
now
that
there's
was a
less
really-
houses.
That's not
that
the-
was
right,
a
Selling
exactly.
for less. They're
Exactly.
gone.
Yeah. Interest rates.
They went.
But, having
just in
budgeted
houses, I
only
think that's the biggest one.
1.1 last year,
It's not-
we
yeah.
really didn't know what was happening.
Well, we thought it was a 1-year blip, and it's
Yeah.
now a 2-year trend, so we'll see. Okay. I think 2 is a good placeholder. Do we agree? For the preliminary
Yeah,
analysis
but
there.
we'll
Yeah.
we'll look at it later when
Yeah.
inventory starts building.
So down to the parking department is projected down 21%. FY22 was budgeted 650,000. I'm sorry, 1.1 million, and this year we're budgeting about 900,000. You can see the year to date right now is at about 500,000, and since a lot of these permits are being sold, I believe in October or before October, it's almost at the point where it slows down, and a whole lot more revenue on top of that for permits.
Yeah, I mean, I think you might get some because people can prorate but
Right.
because the push is to get back to the city. So, but probably not tons.
Right.
Yeah.
And
We paid.
the last item is just operating transfers in, which is just the 2.4 million of bond premium being spent, which is being put against the debt service interest payments, which we talked about a couple of times. I believe another 300,000 transfer in from the police extra duty fund. That is it for revenue.
The police extra duty fund, that was when we were cleaning up like the funds last year, right? Correct me, weren't we gonna use that for police specific purposes?
Cars.
Capital,
You
yeah.
did,
We did for
Right.
cars,
you did use some, you're gonna be using some more.
Right,
cameras, maybe. Yeah.
right. But so this transfer in,
Yeah, where is that?
is this transfer in coming into the operating versus capital? Just from that fund, I'm just wondering how we're using that fund.
But actually, that won't be an appropriation because it's a transfer
Right.
out of a fund for,
For
It's gonna-
which?
If I'm understanding right, it's gonna come for the extra duty fund and we're transferring it in now, approving it that we're gonna use this for police in the general fund.
That's just one. I want to make sure it's going, I mean, I know it's
Yeah,
just
it's
one
going
hit,
from fund
doesn't
to
the
fund,
other, but it's
going
used for
into
that
the
purpose.
general fund. for
Okay.
police,
Yeah, whether it's cameras or security or
Right.
something, yeah.
All right.
Okay.
And so there are a couple general government capital items. That's the town, the tax assessor.
What page did you jump to?
We're on the
Last
back of the.
page.
Last
Just turn it up.
What in the larger presentation?
No,
I don't have the.
oh, here.
summary.
Right here. Okay.
Yeah, I have too
So the
much.
tax assessor has the 2023 townwide revaluation, which is broken up from FY '23 and FY '24. I believe it's beginning in January of 2023. So it's broken up between the 2 fiscal years. In terms of IT departments, it's pretty much their standard IT hardware, software, and WAN software, hardware. Not sure why that's reversed. So that's 80,000 apiece. That pretty much moves forward through the 5-year plan. And that is actually it for capital for general government. That is all.
Team? Remember,
No, I think
question for now?
that's a. Makes sense, yeah.
Okay. All right, for now. Thank you both.
Thanks.
Nice job, really nice job. And then we have, is Lisa, who's Lisa on the line? Is she online? The library.
They're online.
Yeah, I'm
I thought they
surprised.
were
I'm
gone.
surprised.
Jesus.
The library deck.
Good evening, everyone. Can you hear me?
Yes, we can. Hi, Lisa.
Thank you for thanks for inviting me tonight. I've got a few slides to illustrate what's been happening at the library for the past year or so before we get into the more detailed level of the budgets. So first up, just a bit of a note on what it is we do at the library. We're completely focused on serving this community. And over the past year, the teams have delivered an exceptional level of service, even as we've been constrained by the pandemic throughout. The level of flexibility and creativity, the partnering with nonprofits and Town of New Canaan Parks and Recreation and Health and Human Services has given us the ability to really continue to serve in all sorts of new and different ways while we haven't been able to do nearly the level of in-person programming. So 80% of New Canaan households currently have an active library membership. As of 3 weeks ago, that number is correct. And we hear often from our families around town about how much they appreciate and value the service they get from the library. And on the screen, you can see a selection, a very small selection of the notes that we got this past year.
Did we lose Lisa?
No, I'm here. So we had to take the vast majority of our children's programming outdoors. And you can see here that we were at all of New Canaan's parks this past year. We were at Waveney, we were at Irwin, we were everywhere. We worked with Mounted Troop, and we did manage to have, in a brief period of time when things were a little bit looser on all of the restrictions, some programs in the library as well for our children. The adult services team, and as you can see here, it was when the mask, a lot of the mask mandates came off, but our team is down at Lapham quite regularly teaching technology classes to the folks who are using the Lapham Community Center. And we also do office hours down at Lapham for one-on-one technology help. This year, we did a lot of partnering with the Land Trust and the Nature Center, including this one recently, just in late fall, which were local history walks out on the Land Trust trails. So looking back, because obviously the pandemic has turned everything on its side, but over the last 8 years, we've seen the programming attendance at the library go up 86%. In the last year before COVID, we had just about 40,000 participants in our programming. The next several slides will show comparisons between us and our peer group. And just for reference, this is our peer group. We choose these towns because they are neighbors. They are in the top 11 most affluent towns in Connecticut, according to the Angelic rankings. And importantly, they are all association and not municipal libraries, although not everyone has the exact same organizational and funding structure, but they are all association libraries. So this is the peer group we've been using for many years. So looking at some comparative stats, program attendance per capita during the COVID year, you can see that we were second out of this group. And yet we spent second to least dollars per capita to provide that level of programming for our community. In terms of lending, we circulated second most materials per capita of all of our peer group last year. And yet we spent third from the bottom in terms of dollars per capita.
Lisa, what is Westport doing to get their program attendance so high? Is there anything that they're doing different? Is there any reason for that?
I think it might be that they've made an error in their filing, but I don't know that for sure.
Wow.
That's a biggie.
Touche.
What a loaded question, huh?
We are live.
So yeah, I know. I said it very hesitantly. I don't know for certain. It is so far outside of all of our other peers. I got asked the same question by the selectmen. At the time, I didn't have any further information, but subsequently I've heard that everyone's asking the same question because it is such an anomaly. We don't know is the answer. The honest answer, we're not sure. But we're all asking that question.
Okay, thanks.
Yeah. So this is turnover. So this is a measure of the quality of our collections, really, and the level of use. This is the measure of how many books we have against how frequently the books go out. So having a high level of turnover means that we are really doing a good job at getting the right books, the right materials that our community is really interested in. Any questions on any of those service metrics before we move into the financial side?
Lisa, what's the comparison of the actual dollar amount of grants for some of the competitor towns? Darien is at what level?
What, I'm sorry, I didn't hear. What's the exact question?
The dollar amount that Darien and other towns give to their libraries as their.
Well, getting to the finance side next, so we can look at some of that. I don't know Darien's exact budget right off the top of my head, but I can find out.
Hey, Lisa, it's Amy. When you talk about the material circulation per capita, Darien's got a bigger footprint than we do. Currently, I don't know the size of these other libraries. Do we have a smaller number of items to lend out?
Nope. But No, but they spend significantly more on materials. So for example, right at the moment, the Lincoln Highway is really popular. They're likely to buy significantly more copies of that book than we can because they have a much larger budget for materials than we do.
So they do have more actual unit items to lend out.
No, it's not necessarily, no. But they may circulate them through faster, right? So they may be buying in more and also shedding more, right? Because all of us, like your pantry or your closet, whatever you're getting in, you've got to get rid of the same number. It's a static overall number, right? It's not always growing. So they're spending more. They may have more of those hot items in the moment, but they don't necessarily have overall more units.
Okay.
Where's it going?
So now into the finance side, operating income per capita. And while I don't have the answer to Kevin's question, since Darien and New Canaan have the exact same population, this gives you a sense of the scale of the difference. And as I said, I can find that number pretty easily. I just don't have it in front of me.
I think I saw the other day, I think it was $4 million for Darien, which kind of surprised me.
They're pretty consistent. As long as I've been here for 9 years, Kevin, these things have been the difference between the libraries has been pretty consistent. So total operating income per capita, as you can see there, we're fourth. When we look at the source of our funds, this is for financial year 21, so the year that ended last June 30th. By the time we got to audit, these are from our audited numbers, it was 75%, 75.7% from the town. As you'll see, the state is negligible. Fines and charges were really, really low because it was the year of COVID. And the balance, of course, fundraising. So another way of looking at the municipal grant is municipal grant to the library per capita. Again, you can see here we are fourth. And this looks at CPI since year zero for this chart was 2018, and looking at CPI versus the town's grant to the library. And you can see that this year, this is assuming for the entire year 5%. We're currently running at 7%, but conservatively, I did 5% for this FY 22 and the projections out to 23. So you can see that we're not running ahead of CPI.
Well, just fine. But if you
It's
went
right
from
there.
2010 to 2020, we ran ahead of, I'm sure, without even looking, we ran ahead of it every year. So it's not, I mean,
Yeah.
it's nice to have a little window here of 2 years, but over 10 years, that I would think that's not true. Well, we'll check.
That's 5.
We'll check
That's
that.
5 years, but yeah.
We're pretty much there. I mean, so we're pretty much running
Yeah.
on target. So that's good, right?
I think that's the point. We're not exceeding targets with what the library grant has been.
Well, is that
So
the increase is 5.7%? I was going to ask you what's driving. There are no details. What's driving the 5.7% increase year over year specifically?
I can jump ahead if you like.
We can
or I'll get there.
Okay.
Let's wait.
Just a minute.
Keep going, Lisa.
Wait.
So
It's not
yep. So municipal support as a percentage of total municipal revenue. The generosity of New Canaanites is really a very good news story here. This looks at all gifts and gifts per capita, looking at our peer group. Greenwich had a pretty fabulous year last year. I think it probably connects to the fact that they have a brand new facility last year. When it comes to gifts per capita, Not only are we at the top of this comparison with all of our peers, we're right up at the top of the state, out of all 179 communities.
And this
Lisa, are
does
you
not
talking about
include the
operating?
capital campaign, right? This is just your annual appeal.
Absolutely, 100% just the annual appeal. Nothing about anything in this presentation relates to the capital campaign.
Thank you.
Yeah, certainly. And this is our community's generosity to the library, showing gifts as a percentage of operating. So this is really important. One of the differences is that some of our peers, for example, Darien, they may have a similar proportion of their operating budget from the town, but they have significant income from endowment investments as well, as does Ridgefield and Wilton and Greenwich and Westport. So where do we use all of these funds? By sector of the library. We've had a strategy over the last 5 years to raise our support of our service to families at about 1% a year. We're continuing to do that. The building has continued to require an awful lot of funds to keep it operating. And the other things have held pretty steady. Back in 2018, I had this slide in my presentation, and we talked about, and this gets to your question, Todd, what's driving this increase. In 2018, we agreed that in order to maintain a high level of good quality staff to serve the community, we needed to do better. We had a rate of salaries that was at that point 13% below the average of our peers. And I put forward a suggestion to try to get us up to at least the average of our peer libraries. We haven't achieved what we set out to do, but we've got close. We're currently running only 3% below the average of our peers. And again, only 5 years, Todd, not 10. But looking at the New England Wage Index compared to us, you go back and look, 2018 was year zero. That first year we did make strides ahead. We then sort of flattened out. And then this next year and into 2023, we are, with this budget, we are following as best we can the general trends here. So the answer to your question is it's compensation. This is to show that of that increase in the compensation line, 3% is for an increase for next year. What happened last year, we were here last December 20th when I submitted the budget in December 2020. We put in our projection. By the time we got to April, when the budget was approved, we already had seen an increase on our actuals. And right now, because we've seen a lot of turnover, like so many businesses during the last 2 years, we had a lot of retirements, particularly 11 total staff, not all of them full-time, about half of that full-time. Left us, and we've been recruiting in a very accelerating wage market. So at the moment, based on our current commitments to staffing, we're looking at already a 3.4% increase. And then we're asking for an additional 3% increase for 23. So that is the main driver, but I'm happy to take questions about anything.
Can you just go back? Is the 3.4% increase inherent in the people you've already hired plus 3%? Is that what I heard?
So yeah, so we've already in our existing right now, our current commitment, as in the staff we have on, we're already looking at a 3.4% increase over what we were expecting to pay this year.
Yeah.
Benefits,
All right.
benefits and pensions.
Gee, all right.
Are we showing that in their budget?
And how many openings do you presently have?
0.
So everyone who's hired's been hired and that's caused the 3.4% increase. So then you're adding 3% just for basic salary increases?
That's right. Well, it's not just salary increases. Included in that is because I had 5 people retire. That was several pensions that used to be legacy, people on the legacy town pension. Their replacements have come in on our 403B. So that cost shifted from town to us when those people were replaced. So that's one element, a smaller element, but that's one element. The bulk of it is salaries. Salaries, payroll taxes, all of the things that go into compensation.
Yeah.
And I'm assuming you have in front of you the actual budget.
Why not?
We have to go. Where do we have to go here?
The summary budget doesn't have the detail.
I was just gonna say, do I not have?
Let's
that?
get the details.
Where's the?
Tucker, the only thing we have for a budget is library town contribution, 2.5 million, not a lot of detail there.
There's no detail.
That's why I'm asking.
So,
0.7's more than the 3. I was just wondering if there's something that's an anomaly that's driving the.
We don't have the,
I don't know why you don't have the budget, but I can put it up for you from my screen.
We can put it up. We could, or can you just email it?
You have it conveniently, Lisa?
Just put it up.
Yeah, put it up. If you can read it.
Yeah, usually you all have it in your packet. So, but here we go.
It's on the presentation.
I looked, I didn't see it.
So 5.7% is the increase we're asking from town. Of course, we wouldn't ask for an increase from the town's contribution without putting up our projections on fundraising. As you can see there, we're putting up our expectations on the fundraising events by 14%. We're expecting that coming out of COVID, hopefully in the year ahead, we will see fines, rentals, faxing, copying, all of those things go up. We're projecting a 24% increase on that line again. As you know, the last couple of years, we have not put in the capital reserve. We do need to plan for that. So we need to make sure that out of our fundraising, we are putting money aside to look after the building. Of course, we want to make sure that we've got a capital reserve to look after the new building once it's built.
Have them send that to us, Stuart.
So while we're asking for 5.7% from town, the actual budget increase is 5.9. And then these are the actual lines. So of course, we've got a new line in here with the parking. The compensation here is that 6.6, as you saw in the slides. That represents an existing 3% increase that's been caused by recruiting in this very accelerating wage market and a 3% pay increase. And as I showed you on that other chart, when we compare to the Department of Labor Statistics information, we're not any higher. We're not rising in front of that. We're looking at an increase for our collections. So that's, the book budget, a tiny increase on the money we spend on programming. We've got a lot of increases in software. We have a lot of software that runs everything in the library. All of those are licenses. We also have a new server to purchase next year.
Are you doing that through the town or with the
Yeah,
town? So
I was
IT
hoping,
department, or are you
yeah.
doing that?
No, well, which do you mean?
Well, the server, the software.
Well, the software is all specialty software that's all licensed to the library. We don't have, the town doesn't It's the enormous program that runs the entire catalog of the library, all the books, all the cards, all the information there, and many other bits of software that are used to run the library. So no, we don't have any intersection with the town on that. And the server, I mean, I could certainly ask Chris if he can get a better deal than we can on a server, but you know, but
He provides.
we haven't.
Yeah. Just
Um,
the $200,000 for the taxpayers to pay for fundraising events. What does the board think about that one?
I'm sorry, where is that?
I think it was pretty high up on your list. One of the
Can you
second.
blow that up at all, Josh?
It was the second or
Here,
third.
fundraise, it's 77,000 is the fundraising expenses. That's an income line up here.
Where is it, Josh?
That's income. That's not expense.
Fundraising event, that's the income.
Thank you.
Income,
Yeah, okay, good.
income.
Yeah. You said expense, that's why I was asking. Okay.
No, okay, yep, that's all,
Hey, Lisa, in terms of your projections, in terms of revenues, you know, bouncing back from COVID, given you're in a construction zone, I don't know, is that, I mean, are you expecting the same flow through of people during this period of time, or is that moderated from prior years? You know, just because it's a
so,
little tougher to get there. I mean, you know.
yeah, no, we're not seeing any impact of the construction, but we saw obviously a large impact from COVID. So what we saw was that in the months, say since summer, we were seeing slow increases back. We were not back to normal when construction started, but the construction hasn't changed that. We're actually seeing door traffic has been going up slightly ever since construction started. So no noticeable impact on door traffic by the construction.
All right, thanks.
So I'd like to get back to this.
Me too.
The 2.5 million, the town grant, does that include the health benefits and pension expense? Or is that separate?
So there is no pension expense, but it does not include the health insurance. That's on the town's budget.
Yeah, but is that part of the 2.5 million?
It is not.
Okay, so that may be the difference with Darien, because when I look at Darien's town budget, they have 3.996 million for their library grant. They may include their benefits in that number.
No, well, according to my conversations with them, I don't think it does, but we can look into that.
I'm startled by the fact that if they're 4 million versus 2.5, I mean, that's a good story.
It's Kevin, it's been the same as long as I've been here, that difference. And I show it every year in that graph.
Yeah.
We need to think about the combined cost, right? Because the health benefits are part of the cost of the library.
Well, but Darien may include their health
Yeah, so I
benefits in
think
this
they're
number.
included
That's my point. I just couldn't, they may be in there.
Yeah, they're probably.
And you still have some employees on pension.
The current, I think it is 2 employees, and I think the current amount is less than $1,000
Okay.
from the town.
Right.
Yeah, but that it's all added together, and I think we would get closer to.
Yep, that may be the difference. Yeah.
Yeah,
But I
let's
think one of the
just,
things
let's
that
just
it's
find out.
important-
No, we report it in the same way. So, no. Darien and we are the closest to libraries in all of these that do everything exactly the same way.
Could we just find out, there's some difference of $1.5 million, it's 50%. I'd like to know what it is.
Yeah.
Do they have more staff? I don't know. You know, so-
No, I don't think so. They're not that. They never were.
Hey, Josh, that page
Is.
we only have a line item on that.
Yeah, I don't have.
So
Yeah.
if
So
someone,
I think
Send that
I
out.
can't speak to Darien's budget. Like that's
We understand.
just something, I'm not an expert in Darien's budget.
Yeah, and while we get the page from Josh, I just had a question. So the 5.7% requested increase in the town contribution is $137,000. And the question is on the call it 75-25 split between the town contribution and your fundraising, that's your 100%. Is that $137,000? Does that represent 75% of what you anticipate to be increased expenses? Or is the town contribution that you're seeking represent more than 75%?
Okay, you keep trying to keep the ratio the same.
Well,
Is
right.
it a
Yeah,
ratio?
well.
I don't really understand the question. I'm sorry, I'm not following the question.
So put another way, is the $2.5 million budget request still represents 75.7% of your total budget?
Well, we can look exactly what it is. It's somewhere between 70 and 75%. I mean, we can do the sums. It's all just there.
Yeah.
We need the details.
It's probably,
We can figure it out.
Yeah,
We'll be able to
sorry,
figure it
Lisa,
out.
we don't have that page.
Yeah, it's okay.
Yeah,
We don't have the
they-
detail
They
and
didn't load your budget on our.
I'm
tablet,
not
so we don't know.
sure the detail will answer Tom's question, which
Why
is
not?
of
well,
the,
we could,
was the increase, the full, is that increase, simple question, is it 100% of your total increase? Or,
no, you can see, no, you can see there that we're putting up our income by 14%. We're putting our fundraising events income up by 14%. We're putting our direct mail projection up by 1%. We're putting our, a bunch of other small bits of revenue up by 24%. So that was what I was trying to explain in the beginning. We're putting our side up higher. The total increase on our budget is 5.9%. We're asking the town for 5.7 on their portion. So in fact, it's less, right? The town, what we're asking for the town.
Maybe you could
We have to
just
see the
define,
details.
We should look at
let's
the numbers.
just see the sheet.
Yeah, I mean, the
Yeah.
actual number is,
Yeah.
they're asking for $137,000.
well, let's get the details.
75%. It's
Last-
75%.
Okay,
Seven.
that's
Okay,
great.
thank you.
That's good. We'll get the page. We'll go through it. If we have any follow-up questions, we can go to
So-
Lisa. Any other questions for
Yeah.
Lisa? Lisa, anything else you want to cover?
Are you, so it seems that somebody's taken my slide of the budget off and put up this one. Are you all seeing what I'm seeing?
Yeah,
We can't really see
Can't
it.
speak
yeah,
to
that's
what
the
you're
town's
saying.
budget. That's our version of your budget.
Yep. Okay. So that's where you can see the,
Not the.
Right. you can see the total operating income. You can see the town's portion. The town's portion in this proposed budget is 75% of the total. So,
Okay,
so I think that was the question, right? Is it the same proportionally? Yes, it is.
okay.
Is
That was the
there,
question.
is there a health line item there?
So this is the, no.
So
Is there
that's-
what?
like what? Is there a health line item there? I think that's one of the differences with Darien.
Yeah.
They may consider their help with the health benefits as part of
They
their.
don't, but I can find that out for you.
Okay, okay, let's stop. We can guess one more time, but I'm pretty sure we're gonna have the exact same answer.
Page
Any other questions
29.
for Lisa?
It's not the same.
Okay, Eddie, Cap,
Page
Judy,
29.
we gotta get it. We'll get everybody one
got it.
common
Wait,
accurate page.
actually,
We'll answer this question. Or we'll keep guessing.
Got his answer.
You guys did. Well, you didn't get yours. You didn't get yours.
I got mine.
Exactly. Okay, any other questions? Lisa, anything else for us?
No, I'm super happy to answer any more questions about this budget that anyone has.
Does Wilton include their, I'm kidding. Okay, I think we're good. I think we exhausted it. Oh, we actually probably know the answer to that question with you here. All right.
So one thing I would have said was the energy. I did want to talk about that briefly. If you have a second, you'll notice it's up. That's only because we're likely to be moving from one building into the other during winter, which means I'll be, having to, for a brief time anyway, we'll have to be running two buildings simultaneously. So you'll see there's a small increase on energy that should go back down the next year.
Okay.
When we only have one building to run, then of course we will be bringing a second building online with the legacy building. So I don't know what the implications of that are yet.
Okay. Thank you for that. Anything else, team? Thank you, Lisa.
Thank you.
Appreciate it.
Thank you all. Bye.
Okay, that was our last presentation for the night. We have to, unless there are any other questions on those items, we have a few follow-ups. We need to adjourn this meeting and then move into the next session. Anything? Okay, then a motion to adjourn.
Move.
Neil, second. Tom, all in favor? Aye.
Aye.
Do we need to pick up